Hello everyone, we are a group of students from Nguyen Sieu School which is doing a project with an aim to spread awareness regarding COVID-19 vaccination. As we all know, vaccination is essential for today's life because to protect our safety, medical scientists have developed vaccines to prevent diseases that are dangerous to human health. But many people choose not to get vaccinated because they fear the symptoms after vaccination, which may affect their health. A typical example recently is COVID-19 vaccine. The WHO suggested vaccinating against COVID to fully 70% by June 2022 to build an immunization globally. In addition, a few of the world's 82 poorest countries, including Bangladesh, Bhutan, Cambodia, and Nepal, have reached the 70% vaccination threshold. In other countries, less than 20% of people are vaccinated. The virus that causes COVID-19, SARS-CoV-2, was first discovered in December 2019. There are many types of vaccines for COVID-19 like Pfizer-BioNTech, Moderna, Oxford-AstraZeneca. Covishield is the first vaccine to be approved by WHO on February 15, 2020. By December 11, 2020, the Food and Drug Administration, FDA, had granted the first ever emergency use authorization for the Pfizer vaccine. More than 12.7 billion doses of the COVID-19 vaccine have been distributed to nations worldwide, but only 4.95 billion people, or roughly 63.4% of the world's population, have received the entire recommended dose. So we are only 6% far from the target point globally which was mentioned above. Because our aim is to clear the myths about COVID vaccination that worry people, we are going to discuss in this video the fear and anxiety about COVID-19 vaccinating. To begin with, we have to explore what causes people not to get their vaccination. We figured out some typical reasons why people aren't getting their vaccination or are postponing it. The first major reason is the side effects. The COVID-19 vaccines were created, accepted, mass-produced, and dispersed in record time. Although this was a marvel of science, government power, and business creativity, the quick procedure raised doubts about the adequacy of protocols and increased worries about the safety and efficiency of the vaccines. According to Vox in 2021, these worries may be related to a true vaccine side effect, such as a day or two of aches, a fever, weariness, or, in rare circumstances, blood clots. In the survey conducted by YouGov in 2021 among 1,500 American citizens, 90% of those who said they wouldn't get the vaccine claimed they were more worried about potential vaccine side effects than the effects of COVID itself. NBC News reported in 2021 that some people might worry that a day or two of exhaustion and fever resulting from vaccination can cause problems for their working efficiency. However, some people are worried about things that haven't been proven, including unfounded assertions regarding infertility or other long-term health problems. The second cause which is popular these days is people not considering COVID-19 is a problem. CBC in 2021 stated some situations in which people who already got COVID didn't think they would need to be vaccinated. They believed they had natural immunity and didn't consider COVID as a really big problem. Moreover, recently, the world does not experience as many serious COVID cases as 1 to 2 years ago and start reaching the new normal. The WHO president declared that the end of the pandemic is now in sight as the number of weekly reported deaths from COVID-19 hit its lowest level since March 2020. As a result, many people think that it is unnecessary to be vaccinated. So what are the effects of not getting COVID vaccine? Well, the main effects are obviously an increased chance of both obtaining COVID-19 and transmitting COVID-19 to others. The New York Times stated that vaccinated people were less likely than unvaccinated patients to experience the signs of long-term COVID. According to Heather Scobie, the head of the Commissioned Corps of the U.S. Public Health Service, unvaccinated people had 17 times the rate of COVID-associated mortality compared to vaccinated people. Moreover, not being vaccinated can give people difficulties when traveling in some cases. For example, foreign travelers flying into the US must be fully immunized and show confirmation of immunization status before boarding the aircraft, according to Travel State in 2022. However, some other places don't have additional testing regardless of vaccination status. For instance, CN Traveller in 2022 stated that beginning on March 18, 2022, no visitors to the UK, immunized or not, need to test or isolate upon arrival. Recently, the seriousness of COVID-19 is decreasing, therefore, it does not really prevent people from traveling if they aren't vaccinated like in the past. So what do the world think of this issue? The map shows the COVID-19 vaccination delivery allowance. This shows the acceptance of countries and the globe as delivered. Most countries accept universal vaccine delivery through blue color. This shows how the world accepts COVID-19 vaccination. The WHO is encouraging people to have COVID-19 vaccination. According to ourworldindata.org, 68% of the world's population has received at least one dose of a COVID-19 vaccine. This shows the world, a majority of governments and citizens care about human health and life, willing to have vaccinations and spread vaccinations in order to save lives. To have a clearer understanding of the world's response to COVID vaccination, we will look at some different perspectives, especially nations. On February 26, 2021, the Vietnamese government issued Resolution 21/NQCP on the purchase and use of vaccines against COVID-19. Additionally, more than 70% Vietnamese population had been vaccinated, and more than 257 million shots were injected. Moreover, the capital to buy vaccines is from Vietnamese donations themselves. This proves the Vietnamese people's positive attitude toward COVID-19 vaccination, even willing and wanting to get as many vaccines as possible. To have a better understanding on how different perspectives respond to this issue, we have to consider multiple cultural perspectives, starting with religional. According to research done in Guinea, 46% of Muslims and 80% of religious authorities believe vaccinations are not permitted during Ramadan. This shows some religions don't accept COVID-19 vaccination. Numerous religious groups, including Protestants, Catholics, Jews, Muslims, Christians, Amish, Hindus, and Sikhs, have claimed religious justifications for vaccine reluctance. Next cultural perspective is political parties. Gallup reports that 26% of independents and only 3% of Democrats intend to get immunized, compared to 40% of Republicans who don't plan to do so. On the other hand, the Communist Party of Vietnam orientate their people to vaccination. This shows different parties have different perspectives and actions regarding COVID-19 vaccination. In particular, communists seem to have a better attitude, opposite of independents, Democrats, and Republicans. Next cultural perspective is vaccination and unvaccinated people. We conducted a survey to see the perspectives and experiences of people who are vaccinated and unvaccinated. These are the results. This survey aims to explore people's attitudes regarding COVID-19 vaccination, both vaccinated and unvaccinated. We split the survey into two parts, for the vaccinated and unvaccinated. Our respondents are mostly high school students. This shows how essential vaccination is to vaccinated people, with nearly 80% of the respondents agreeing that vaccination is essential, which strengthens the claim that vaccination is necessary. Most people, exactly 90.2% of the respondents, don't feel anxious. This shows how people trusted vaccination, which strengthens the claim that vaccination is necessary. Most people, exactly 47.5%, feel fine after vaccination. This shows a positive attitude from people against vaccination. Not to mention, they feel fine for the reason it might be the safety of the vaccine or the feelings afterward. Shown, most people feel sick or fatigued after vaccination. However, no one faced the circumstance when their life is threatened. This makes the vaccine more reliable with its immunity effects without having too many dangerous, harmful side effects. In conclusion, most of the responses are positive, and the side effects still appear but don't affect much. This is a good sign, confirming that vaccination safety is guaranteed. Vaccinating, according to unvaccinated people, is not that necessary, since 60% of people claim this as neutral. In conclusion, most of the responses on this side confirm that not vaccinating is due to awareness and fear, which strengthens the claim that some are missing information about vaccination, leading to misunderstanding, fear, and being unvaccinated. To conclude, our survey contributes, proves, and can be stated as a piece of evidence for the safety and essentials of COVID-19 vaccine, simultaneously, a positive attitude from people to it. Furthermore, we conducted an interview with Professor Dr. Than Dat, the director of the Center of Technology Transfer of the Vietnamese National University, has many years in the field of medical technology and politics, and is an inspiration to many startups in the both disciplines.
Xin chào các bạn Thành Đạt, tôi là người phỏng vấn của nhóm học sinh đến từ trường Nguyễn Siêu đang thực hiện dự án phục vụ mục đích tuyên truyền tầm quan trọng của việc tiêm phòng vaccine COVID-19 và tác hại của việc không tiêm chủng. Chúng tôi xin phép được hỏi ông một vài câu hỏi. Theo ông, tiêm vaccine COVID-19 để làm gì?
Theo tôi, tiêm vaccine COVID-19 là biện pháp quan trọng để bảo vệ sức khỏe cho bản thân, gia đình và những người xung quanh. Vaccine COVID-19 giúp cho hệ miễn dịch nhận biết và sẵn sàng chống lại virus corona nếu chúng xâm nhập vào cơ thể.
Vậy thì theo ông, tầm ảnh hưởng của vaccine COVID-19 là gì?
Theo tôi, vaccine COVID-19 là một thành quả vô cùng to lớn bởi vì đại dịch COVID-19 đã gây tổn hại lớn về người và của cải, ảnh hưởng nghiêm trọng đến nền kinh tế toàn cầu. Theo tôi thì tổn hại lớn nhất đó là ảnh hưởng tới sức khỏe và tính mạng của con người. Cho đến nay thì chỉ có vaccine mới có thể phòng bệnh một cách bền vững và chỉ có vaccine mới giảm được các số ca mắc, giảm thiểu được rất lớn nguy cơ tử vong khi mà mắc COVID-19.
Ông nghĩ gì về việc có những người chưa tiêm vaccine COVID-19?
Tôi cho rằng những người chưa tiêm vaccine là những người còn có những sự vướng mắc về tâm lý hay là có những nỗi sợ về tính an toàn của vaccine. Trong thời điểm trước đây khi mà đại dịch bùng phát thì tôi có nghe rất nhiều thông tin và thấy những ca mắc COVID-19 chưa tiêm vaccine thường có các triệu chứng nặng, nghiêm trọng và có nhiều trường hợp thì tử vong. Vậy nên là tiêm vaccine để giảm nguy cơ mắc COVID và ngăn ngừa bệnh tiến triển nặng, giảm nguy cơ tử vong nếu mà có mắc bệnh.
Vậy ông có nghĩ rằng tiêm vaccine COVID rất cần thiết cho tình hình hiện nay?
Tôi nghĩ việc tiêm vaccine COVID vẫn cần thiết bởi vì kháng thể từ việc tiêm vaccine phòng COVID sẽ giảm dần theo thời gian. Vì vậy để duy trì miễn dịch COVID, giảm thiểu nguy cơ mắc COVID hay là mắc lại COVID và đảm bảo được an toàn sức khỏe khi mà bị mắc COVID thì chúng ta vẫn cần tiêm lại các liều nhắc lại.
Chính phủ, tổ chức Việt Nam đã phản ứng thế nào về vấn đề này?
Tôi có tìm hiểu trên các phương tiện thông tin truyền thông thì thấy rằng chính phủ Việt Nam đánh giá việc tiêm vaccine COVID là điều cần thiết để phòng ngừa COVID. Thời gian qua thì công tác tiêm vaccine phòng COVID-19 được thực hiện rộng khắp ở các địa phương trên cả nước. Tôi cho rằng kết quả tiêm vaccine đã có phần quan trọng trong việc kiểm soát dịch bệnh trên phạm vi toàn quốc và nhất là giảm thiểu các tình trạng bệnh chuyển nặng, nhập viện và tử vong. Qua đó thì đã tạo điều kiện để phục hồi và phát triển kinh tế xã hội của đất nước.
In conclusion, Professor Dutt has stated the definition of COVID-19 vaccines, the reasons behind not vaccinating, his perspective on the issue and also the government's perspective. According to Professor's statement, vaccination is essential for everyone and even in nowadays circumstances, people still have to vaccinate in order to protect themselves from the coronavirus. The information provided by the doctor gives us a viewpoint of a professional, containing facts which help clear the myths. His opinions also enrich our outcome. As the serious consequences of this issue continue, we have to take actions immediately. To limit false worries of COVID vaccination, there are several actions that can help. First of all, there are many rumors which haven't been proven scientifically about COVID-19 side effects. To solve this issue, we need to educate people, clear up incorrect rumors about the vaccine, and spread awareness of facts. In Vietnam, the government always publicizes information about COVID-19. The local people also encourage each other to get the vaccine because we know that it's safe since our government provides everything we need. Secondly, the death rate among unvaccinated people is still far higher than that among the vaccinated, even though vaccinated people now make up a significant proportion of deaths. Amanda, 2022. So to solve this, the government needs to improve/create new COVID-19 vaccines to minimize as many negative effects as possible. For example, a coronavirus vaccine in the United States and Mexico was released recently by the underdog vaccine company Novavax. The vaccine contains SARS-CoV-2 protein, a different technology from the COVID-19 vaccines approved so far, and it provided 100% protection from moderate to severe disease and 94% overall efficacy against symptomatic infections. We hope that you have learned some things about a topic that seems very familiar, like COVID-19 vaccination, through our video. From that, each of you can make the best decision for yourself and or your family about taking COVID vaccination. Thanks for watching.